You ready? Okay. Good stuff.
All right, come here. Let me just do this.
Oh, thank you.
Just girl stuff, right?
Cool.
Yes. Thank you for doing that.
Okay.
Thank you.
Okay.
Good, good, good.
There we go. You have really pretty hair.
Well, thank you.
I used to be a hairdresser in my former life.
Really?
No way.
Yeah, for 16 years. I did hair.
Cool.
No way.
Yeah, I say I don't know what I'm going to be when I grow up.
And then you left that when you got sick?
Yeah. Oh no, I started a retail business about 10 years ago.
Okay.
Yeah,
And you started that before the 343?
Mm-hmm.
Okay.
Yeah, and then I've kind of abandoned that. It's still going, but
Okay.
I don't really have much to do with it. Except I'm doing 2 more retail build outs right now. A coffee shop build out, and then another store next to my store. It's going to be merged together. So
Okay. Is that the Codfish Cowboy?
Yeah,
Okay.
it's so fun.
That's
so fun. If you ever come to Long Beach,
Yeah, I'll have to make it because
Yeah.
I see some of your merchandise. I'm like, oh my God, that's hysterical.
it's so fun. Yeah, I love it. So it's just kind of like my childhood dream fulfilled.
Right.
But you know, I've got more dreams, so I don't know
Oh yeah.
what else.
It's nice to continue to evolve.
Yeah.
Yeah.
So
Yeah.
yeah.
Well, welcome to the podcast.
Well, thanks for having me.
Welcome to Holistic Health. We have Angela Skudin with us today, flying in from New York. So very exciting. We had dinner last night, and we had some meetings this morning, just spreading the awareness about psychedelic therapy and healing, especially with first responders. So go ahead and introduce yourself.
I'm Angela Skudin. I'm the founder and CEO of the Casey Skudin 343 Fund. We are a grant writing organization that provides psychedelic grants to first responders. We also provide contrast therapy, saunas, and cold plunges to firehouses and police departments for the interest of detoxification and self-care and wellness.
How long have you had the organization for?
The organization began a little bit after my husband's death, which was June 17th, 2023 at 3:43 p.m. We started the 343 Fund, the Casey Skudin 343 Fund, about 2 months after he passed away.
Okay, great.
So we're just a little over 2 years now.
How many first responders have you helped to date?
We have provided grants to over 80 first responders, and we've got more on the books that just haven't gone yet. But yeah, we're entering to about 95 right now. It's how many that have been given an actual grant from the 343 Fund.
Awesome.
Yeah.
Well, we'll make sure to spread the awareness with the fund because it's fantastic. I'm very amazed at how broad spectrum the holistic approach has been for first responders. And I want to grow awareness, especially in our area and across the board. One thing that drew me to your story, I was driving to work listening to your Ambio podcast with Trevor, and I was driving, I'm like, holy shit, this is amazing, her story, with the whole health and wellness journey that you've been on. Being in practice, I've seen so much autoimmune, so much Lyme, so much unresolved illness in Western medicine. And you educated me on so many things, including the bee venom therapy and then, of course, the psychedelics. So share with the listeners your story, your health journey to start out.
Wow, where to begin? In 2018, I became really just ill with what were perceived as autoimmune conditions. Initially, it just seemed like I was just having back problems and hip issues just from just being athletic my whole life and working out and maybe just not giving my body the proper rest. So I thought that I was looking into having a couple of surgeries. I was in nerve pain and just really severe back pain. And I went to the doctor just doing what everybody else does, what's wrong with me. And they said, oh, you have a labral tear in your hip initially, and we should operate on that or wait. And I thought, I'm a person that likes to wait. So I waited, and then my body just started disintegrating. I ended up with 2 fully bulged herniated discs, a piriformis nerve impingement, left side scoliosis, spinal stenosis, degenerative disc disease. On top of that, just simultaneously, it seemed that I had this Lyme infection that was either present and then came out of, reactivated in my system, or, I was bitten by a tick at the same time.
Yeah.
Who knows?
Right.
But no one knew what was wrong. And I started getting gum degeneration and just different things that were kind of pointing towards like fibromyalgia type symptoms. And just went on a long road of every time I would go into a doctor's office, I was genuinely looking to go to the specialist, and I was leaving today with a diagnosis. And that just kept not happening over and over again. And just the surgeries were what were offered, and the surgeries were going to really change my life physically. I wasn't going to have the physical capabilities if I had this hip surgery and this back surgery that I would have had, if I was able to rehabilitate my body in some, natural way, or even if I found a Western medicine route. The only route at the time were the surgeries. And I saved those off, and I continued looking for answers because I just had so many more complications in my body that were just unrelated to the back and the hip. And I thought, I'm having neurological symptoms. I'm having inflammation. I'm having pelvic pain. I had these sores that were all over my body, and they just wouldn't heal. And no one could really figure out what was going on. And I just started researching and reading, and I came across just some literature and some books that people had written regarding mold toxicity and Lyme disease. And I found out that I initially didn't think I had Lyme disease or anything, because I had taken, the Western blot and, the ELISA prior to that,
Right.
and they always came up negative. And at that time, I didn't know anything about testing. I didn't know that, it's super common for Lyme disease to go undetected on those testing methods. And in fact, like those testing methods weren't even developed for Lyme disease. They were initially developed for AIDS, or HIV, rather. And then there was just so many components to why you would test negative that I didn't know about lab testing. So it kind of appeared to be a kind of a Russian roulette whenever I was taking the test, and that maybe something was being missed. So I found other tests. For me, I used the IGeneX test. I flew to California to see a Lyme specialist there. Was clinically diagnosed with Morgellons disease and a couple of other tick-borne co-infections that you could just tell from that you could get from a clinical diagnosis. I'm unsure which ones of the gamut that I had were able to be clinically diagnosed, other than the Morgellons at the time. And then I tested for the Lyme, and it came back positive, along with the co-infections, Babesia, Bartonella, and relapsing fever Borrelia. So from that journey, I came up with 3 co-infections that I had: the Lyme disease and the Morgellons disease. So I immediately thought at that point, hallelujah, they found out what's wrong with me.
Right.
Great. What prescriptions are you giving me? And in 30 days, I should be good to go. And I remember saying to the doctor, great, so you're going to write me these prescriptions, and then these sores on my legs and stuff, like, they'll be gone by summertime, right? This was December of 2018, and she said, no. And I thought, what do you mean? Like, you diagnosed me, you're going to give me some pills, and what do you mean? Like, we got 30 days. And she said, you'll need to be on antibiotics and antiparasitics for 5 to 9 years to have a possibility of clearing this. And I thought, I don't have that kind of time.
No, and you were young when this all started.
Yeah, I was at the time, I'm so bad at math, I was 38 years old, 37, 38. So
Jeez.
that was kind of when I heard that was just a huge balloon deflator, where I just thought, oh my God, this isn't going to be easy at all. And it wasn't easy at all. I did the antibiotic protocol. I ended up in the antiparasitic protocol, and I ended up getting a PICC line placed in my arm, receiving IV antibiotics for 4 or 5 months, and then daily. And then that pretty much destroyed my gut, my microbiome, and just really caused a lot of gastro symptoms, and just really struggled with that, building that back up. It got to the point I was on different protocols. Lyme people know like the different protocols and whatnot. I ended up going on disulfiram protocol, which is it was for it's off-label use for Lyme disease, and it's just things that just have to be really monitored closely with blood work and everything. And it got to the point, not that I wanted to stop the Western medicine treatments, it just got to the point where they were unaffordable. One of my prescriptions was, I believe, it was $5,000 a month, and that was just one of them, and we just didn't have the money to come up with that. So in all, it was $5,000 a week for my IV treatment, and then one prescription was $5,000 a month, and then I was just taxing my poor family with my health situation, and we were having to borrow money, get money from family, talking about taking, a substantial portion of my husband's pension out to pay for treatments. And I kind of ran out of Western medicine options and affordability. The next step for my treatment was going to be to go to do this treatment in Germany, where this is actually pretty common, but it was $80,000, and they were going to give me a fever, put me in a coma, give me a fever, and then hopefully that was going to kill everything. But it wasn't guaranteed or shown to kill a few of the a couple of the co-infections that I had. So it was kind of like I could potentially die. It's going to cost $80,000, and it's not even going to get rid of everything. So
How did they put you in a fever?
You know what? I'm not sure.
That's interesting.
I didn't get. I mean, I remember looking into it at the time, but like now,
I'll have to go back and look at it.
Yeah. But they do it for cancer, I believe, too. Yeah, it's in Germany. At least the place that I was going to go to was. And so then I had found on social media, actually, I laugh because people say, how did you heal from all these things? And I say social media. But it's true.
Where do you get your info? Google or social media?
Obviously. WebMD.
Right.
So I found this girl on TikTok, and she was doing bee venom therapy. And I thought, that's crazy. Bee venom therapy is actually, you take a live bee and you have it sting you multiple times over your body. And I just thought, well, this is nuts, So I voyeured her doing this. She was doing it for Lyme disease for a year before I had the guts to try. So that kind of went in conjunction with running out of the money and having this, am I going to go to Germany and potentially kill myself, or am I going to sting myself with some bees?
Right.
So I went with the bees.
Good choice.
Yeah. And I started with this traditional bee venom therapy protocol. I say traditional bee venom therapy protocol. I don't know, some lady named Ellie, who was kind of like the forefront of bee venom therapy, she came up with this protocol. She's not a doctor or anything, but she came up with this, and it's helped a lot of people. It helped me, certainly, but there was just a huge detox component that came with it. And I kind of was doing this bee venom, then doing all this detox right after I did the venom, and then my system was really not getting to take full advantage of the venom.
Sure.
So I started doing no detox, just the bee venom, and the protocol was stinging myself with 19 to 26 bees every 4 days, and then waiting it out for my immune system. The bee venom kills everything in the targeted area, just wipes it all out, and then your immune system will build back everything fresh and new. So I did that for 15 months, and along with another plant-based remedy called Kambo, and that pretty much got my body back from the majority of Lyme disease, and the tick-borne co-infections were resolved with those modalities, and enter psychedelics.
Psychedelics.
Yeah. So, yeah, I did the bee venom first, did the Kambo, and then we moved forward to, I found psychedelic therapy from that, primarily Ibogaine, or Iboga.
From the Kambo, like that was the next evolution.
Yeah.
Yeah.
That was like bee venom, Kambo, Iboga.
Why not?
Yeah. And I'd never heard of it. You know, it wasn't, at this point in my life, I'm covered in sores, I'm bedridden, and and not looking to go party.
Right.
You know, I'm like, I'm going to die. I need something.
Right.
So I found this Iboga, and it was through the Kambo, actually, practitioner, and I ended up doing just a really irresponsible thing that could have killed me, and I had no idea. I had someone come and serve me Iboga in my living room, and with no, cardiac check or anything, no EKG, no monitor, no, line in my arm just in case. All the things that we know are so important to do today before entering one of these journeys. And I just ate a bunch of root bark, which is what Iboga is, for those.
As a powder, or how did they give it to you? So
they do it in capsule form.
Okay.
Just a bunch of capsules. So for people that are listening that don't know, Iboga is, it's a root bark that comes from a place called Gabon in Africa. And it appears to do miraculous things for people's healing, not even on appearances, but scientifically.
Sure.
So it's touted as, the most powerful psychedelic on the planet, primarily due to its brain regeneration capabilities. And I sat with that, ate a lot of that, swallowed a lot of those pills, vomited a lot that night. Didn't really see anything. I was expecting to have this huge psychedelic experience, and, I didn't really see anything. And I was quite frustrated after that journey, just kind of vomited all night long and thought, what am I doing?
Right.
I had the day after is traditionally referred to as gray day, and I beat myself up on that day, just being like, what
was I thinking?
What's going on?
Yeah.
This is a really bad idea. Just all of that negative self-talk came flooding in. And it wasn't until later that night when I went to go to sleep, and I actually went to sleep, that I realized this did something. I say that because I was having to drug myself for years to be able to go to sleep, whether it be, Ambien, Lunesta, alcohol, Xanax, whatever. I needed something to sleep. Tylenol, PM.
Right.
Yeah,
and
whatever.
You probably weren't getting a good sleep with those anyway, right?
No.
Yeah.
I was on Adderall by day and Xanax by night. And that is, my body was never sleeping. Hindsight, I feel like all of that correlated to probably the bomb that went off in my body.
Sure.
Was all of that. My body just not resting, and it's like the straw that breaks the camel's back.
Yeah.
And then
boom. Domino effect.
Yeah.
Yeah.
So for me, the domino effect led to a misdiagnosis of fibromyalgia, where I was put on Cymbalta.
Lovely.
And actually developed Tourette's from it, which was super grateful because it got me off of that early without having to.
Wow.
I didn't know.
Yeah.
The ramifications of being on these medicines, for these autoimmune conditions or these conditions.
Right. And you're not informed. Typically, they don't tell you that.
They're like, take this, you're going to be better.
Right,
so,
right.
and people that are in this, will take anything,
Yeah. Fix me.
Just let me feel better. And so that was a blessing in disguise that I actually got one of those negative side effects, because it got me off of that. Also, I said to the doctor, I don't have fibromyalgia. The diagnosis requirement is 9 points of pain, and I have 1,000. And she said, oh, you're right. And then I thought, I'm on my own. No one's coming for me.
No. I'm not getting answers.
Right. So that led to all the alternative stuff. And after my Iboga journey, the first one, I was able to sleep, and that had never happened before. And I noticed it. And it's been 5 years. No, not quite 5 years coming up. And I have slept every night since that journey. I don't have a racing mind anymore. I don't need to think of plan A, B, C. I can just chill. And I've never been able to do that in my life. And it was a direct result of that root bark that night, regardless of seeing one psychedelic vision. I didn't see anything.
Right.
But the healing that was provided to me has been just vital to my existence here today.
And that wasn't even your intention of doing it, which is interesting.
No.
You know, but the medicine, what I love about it is the medicine knew you needed to sleep to heal.
Yeah.
And that was step one.
Yeah.
You know?
Yeah, that's it.
Crazy.
That's how it works. It's like, you know, you really don't know what you need when you're in a kind of a flare situation like that. You know,
Yeah.
there's so much you need.
Right.
But the medicine seems to intelligently know what you need and provide that to you. So I was provided that on my first night sitting with Iboga, and then provided a big education on the responsibility of sitting with psychedelics going forward and the danger of, you know, living room psychedelics.
How did you figure that out? Like, this isn't safe.
I figured out that wasn't safe because the Ibogaine movement came like, shortly thereafter. Yeah, and I started researching into it and realizing, oh my gosh, especially when in the condition that my body was in then.
Oh, sure.
Yeah, it was
super
like,
fragile.
I had a heart condition at the time that, you know, you got to really get tested if you have a heart condition with Iboga. You know, and I had all these other systemic things going on. But again, I wasn't going through a treatment facility.
Right.
I wasn't going through a responsible psychedelic provider. I was going through some dude from California that had a hook in Africa, you know? Oh. And, but that just speaks like to people's just ability and just want to heal. Like
sure.
No one wants to be miserable.
Right.
So I'm sure when you're seeing patients and you see just the frustration of not being able to figure out what's going on in your body, and then the want is you as a practitioner to give them answers, you know?
Exactly. And usually, like you said, they've been everybody else. Mm-hmm. They've had all the imaging, misdiagnosis or lack of, and then last resort.
Yeah. Functional
doc or
yeah,
someone voodoo-ish, right?
Yeah. Yeah. I always tell everybody when they say now, what should my if I'm diagnosed with Lyme disease, like what should my first step be? And I was like, a functional medicine doctor.
Yes.
Like, just go find that. And that's the only person that's going to be able to help you pave a way in the current society that we live in with Lyme disease. That or some shaman from Africa.
Right.
Functional medicine doctor is easier to find.
Yeah, at least in the States.
Yeah.
And you got a great care team right now. I mean, you do acupuncture, you do chiropractic, you do yoga.
Yeah.
I mean, you
sauna. Yeah.
All the good stuff.
So I learned a lot from my experience. It's kind of one of those things where when you're put in that position to live in daily nerve pain for months and being suicidal ideations constantly because, you know, you're a burden on your family, you're a burden on yourself, and no doctor can tell you how to get out of this. So having all of that on me, it was just, there was no option for me other than to figure a way out of this. So once I learned all the ways to get out, I implemented them into my life so that I could make a promise to myself I'm never going to get into this situation again. They say a lot of times, once you know, you can't unknow.
Right.
I know now. So, taking the psychedelic is probably the easiest part of the journey. And then the self-care and that comes after that is definitely the most difficult part. And that's forever, you know.
Exactly. Which, in general, we're not equipped with those tools as a society.
No.
Which is sad.
Yeah, I was. I think we were speaking earlier, like the tools that we get equipped with different tools, or we're taught that our minds should be rewarded for all this knowledge that we have, and then we don't realize that we're just operating with 10% of ourselves, working with our ego mind, and then there's this whole subconscious mind that needs caring for.
Right.
And we're not taught about that in school, and we're not taught about that as adults unless we seek it out. So I started a mindfulness practice from it. I'm not going to say it's something that I enjoy. It's not even, I don't even really like yoga, but
Right.
doing yoga, I didn't have to get any surgeries. My back
Right.
completely repaired itself, and I have more flexibility and more ability today than I've ever had in my life, and I'm the oldest I've ever been. So
Yeah.
it's just kind of like, sometimes you don't want to eat your veggies, but they're good for you. It's the same thing with like the self-care protocols,
Right.
and the yoga, the mindfulness, the meditation, the sauna care, the breath work, all of that stuff. So those were all tools that I learned along the way during my healing journey and my psychedelic integration journey, and they're tools that I implement into my life now. As I don't do all those things every single day, but my mindfulness practice is pretty steady, every day.
Yeah.
So,
Well, like you said,
something.
it's practice. You have to put the effort in.
Yeah.
Yeah.
We were talking about meditation earlier
Yeah.
today, and I said the first time I went to meditate, I remember being so angry. What is this meditation? And I got this book that says How to Meditate.
Right.
And I went and sat in my sauna, and I'm just covered in sores from head to toe with this Lyme disease and so swollen, and sitting in this infrared sauna just trying to sweat it out. I get this book and I open it up. I start reading it, and I don't even know what it said, but it's not how to meditate. And then I just remember just practicing more and more, just sitting in stillness,
Right.
Using my breath to sit in stillness. Meditation is a practice, and your body remembers when you practice. And now if I could sit down and meditate with you in 5 seconds without even accessing that little book.
Exactly.
So yeah, the book's up here.
Right.
Yeah.
Right. It's innate.
Yeah.
Well, and it's
I guess the
uncomfortable.
book's in here.
Right. Right.
Nothing's up here. The book's in here.
It's in here.
Yeah.
Yeah, it's uncomfortable.
Yeah.
And this is hopefully like something I am looking forward to gaining out of my trip in January is it's uncomfortable to sit in your own thoughts.
Mm-hmm.
Because especially as women, I feel like, okay, I got A, B, C, D, and E to do. I'm doing this in my mind. I'm doing this in my mind. I'm not present in the moment, and that just, it's hard.
As women too, we're always, and men also, I have to give this to men. We work with a population of first responders. They're always thinking about others.
Sure, sure.
But women and mothers, like, you're always thinking about others.
Yeah.
It's so rare to put yourself first.
Right.
Which is one of those mindfulness practices that we try to practice. It's like, you're a number one.
Yeah.
If you're not number one and you're not good, no one that you're caring for can be good.
Right.
So that in itself, our society has kind of labeled that as narcissism.
Right.
Where it's actually just deep self-love and self-care. So to even just have the awareness that, like, you need to foster more for yourself is a huge foot in the door in this healing practice. You're yourself going on a journey soon too.
Yeah.
And it's actually the main journey that we write grants for in our organization for first responders. I've been through that journey 2 times. I'm speaking about going down to Ambio and Tijuana, Mexico for Ibogaine and 5-MeO-DMT. And yeah, that 5 days in Mexico really seems to open a portal for people's healing and for their body healing. And as we mentioned, that journey is backed by a scientific study, the Stanford study. So I think as more of these conversations happen, as we're in the psychedelic renaissance right now.
Right.
And as more housewives and doctors are going down to Tijuana, Mexico for Ibogaine journeys, we'll see a lot more healing results.
Normalize it.
Not only that, just it gives me so much hope for
Yeah.
humanity
Yeah.
that that there's something out there that can do all of these things for when we get this out to the generalized population.
Right.
So,
Well, it's ancient medicine.
ancient.
You know, it makes sense.
Yeah. Nobody over and they don't have Western doctors in Peru. And it's interesting that the life expectancies of these places are so much greater than the life expectancy in America. So something is definitely amiss.
Right.
And I think we're on the road to success with it. And I think that just, yeah, having conversations like this are so important. And the more we can normalize it and get the facts out, the more people will be able to heal and have access.
Absolutely.
Yeah.
Well, great. Anything else you want to share with our listeners?
If you want to support or come through a grant with the Casey Skudin 343 Fund, please, all donations are welcome and loved. We are a grant organization and we rely on donations to exist. If you know anybody, first responder, that needs help, please visit the Casey Skudin 343fund.org, and we would love to help you out or get a donation from you.
Any of the above.
Any of the above.
I would love to, I don't know, like when I get back, I don't know, like have a race to raise money for you guys or just
Oh my God, that'd be
something.
awesome.